So let's bring in the president's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thank you for your patience. I want to talk about the president's new goal, 70%. If we reach that goal, I'm guessing you helped him come up with that number, and 30% of Americans don't get the shot, what's the risk to the rest of us?
Well, I mean, obviously, you want to see as many people as possible to get vaccinated. You'll never get 100%, that's for sure. But 70% is both an ambitious and an attainable goal. And the reason we got to that goal, the reason the president chose that, because it's very clear from both other infectious diseases as well as observations of what other countries, including Israel, have done. When you reach a certain level, you're going to see a significant diminution in the number of daily cases, which would mean less hospitalizations, less deaths, and a real diminution in the total dynamics of the outbreak. So I believe we're going to be able to get there. And as you mentioned, on the run into the show, we're going to do that by really having a change in strategy rather than having mass vaccination units. We want to get on the ground to that recalcitrant group of people who don't want to get vaccinated and make it really easy for them to get vaccinated. Have walk-in situations like in the tens of thousands of pharmacies, have mobile units, have trusted members of the community that are messengers that people, regardless of their political affiliation, would listen to. Those could be people in the clergy. Those could be a family doctor. Those could be media and sports and entertainment figures. But we're going to get to them to try and appeal to the fact that they need to protect themselves.
But isn't that more tricky? Because just last week, we had a well-known media figure spreading misinformation. So don't we need to listen to the experts? Because when non-experts who are influencers spread misinformation, we say, oh, don't listen to them. They're not a doctor.
No, I said trusted messengers. I used the word trusted. You're talking about people who know what they're talking about. And in fact, there is a program that is called the COVID Community Core, which is literally thousands of these people where the CDC is providing real-time information to them, correct information about the dynamics of the outbreak, about the kinds of messages that need to be sent so that those people could effectively and accurately reach out to people who don't want to be vaccinated and try to get them to understand why it's important for themselves and what I would call their societal responsibility to the community. Because it's not only about protecting yourself, it's about interrupting the dynamics of the outbreak. And you do that by not allowing the virus to infect you, even if you don't get any symptoms at all. If you get infected, you could inadvertently or innocently transmit it to someone who could have a serious outcome.
But with more and more Americans getting vaccinated, how worried do we have to be about an outbreak? Earlier this week, the New York Times ran a piece saying experts believe we will not reach herd immunity. Do we need to?
Yeah. Well, again, I've said it so many times over the past couple of weeks. We've got to get away from this elusive concept and elusive threshold. If you look at what herd immunity means, it means if you add up the people who are vaccinated and protected, the people who've been infected, recovered, and now have durable immunity, that when you get enough of those, and it's going to vary from disease to disease. Measles is different than COVID. COVID is different than polio. But the entire concept means you get so many people vaccinated, the virus has little opportunity to find someone who's vulnerable, even though there are vulnerable people in that herd. We don't know what that number is for coronavirus because we've never been through this experience before. So rather than people getting hung up on this elusive threshold number, why don't we focus on the end game? And the end game is to get as many people vaccinated as you possibly can, as quickly as you can. If you do that with all the unknowns that we have, the one thing we absolutely know as a fact is that the more people you get vaccinated, the lower and lower the number of infections are going to be in the community. That's an absolute given.
Soon we may be able to vaccinate children, and parents are asking, Should they? It was obvious. Given the risk to senior citizens in the beginning, we should absolutely vaccinate them. But for parents who are now asking, should they vaccinate their kids, it might not be as obvious since the risk of kids getting very sick is much lower. What do you say to those parents on the fence?
Well, it's a continuity of what I just told you a moment ago. It isn't only about yourself and protecting yourself. And by the way, it's absolutely correct. Statistically, children have a much lesser chance of getting a serious outcome. It isn't zero. We see plenty of children who get into serious trouble. But relatively speaking, the risk is lower. But you don't want them to be part of the chain of transmission. That's the point. It isn't only about you. It's about getting the level of infection in the community, because that child, again, even if they don't get any symptoms, may inadvertently and totally innocently infect someone else who might actually have a severe outcome. So if you really want to get control of the outbreak, you want to get as many people vaccinated as quickly as you can, no matter who they are.
I want to stay on kids, and I want to share some summer camp guidelines that were put out by the CDC. They say that everyone has to wear masks at all times, even if you're vaccinated and even if you're outside. Campers also have to stay 3 feet apart. Campers and staff should be 6 feet apart, and you should not be sharing any toys or games. I know you said that those are conservative guidelines. Do you worry that the CDC is being too conservative, and if they don't ease up some of these logical restrictions, people are going to ignore them? I haven't even looked, but I'm quite sure that there are countless Facebook groups of moms saying, this is ridiculous. We already did everything. I'm not going to do anything anymore.
No, you have a good point. I cannot reasonably argue against your point. They are conservative guidelines. The CDC will look at them, reevaluate them, because the feedback we're getting is exactly what you're saying. So you're absolutely right. That doesn't mean they're going to change them around completely, but they need to re-look at them because of the response, the reasonable response the community is having to them. I have to agree with you on that.
Can I ask you, as someone who is double vaccinated, when you go outside, when you go for a run, do you wear a mask?
No.
Do you think the president is still wearing a mask? I actually think he might be double masking. Do you think he should change that behavior because it's sending a mixed message to people? We do follow the president's lead.
Yeah, I know, but I think the president wants to just show, to be overly careful. I mean, but again, he's going to do what he's going to do. I don't think you should make that a negative thing because he's doing that. Not at all.
Once the emergency authorization is lifted on the vaccine, should companies, businesses require the vaccine?
A company cannot require you to do anything. You can, that's for sure. What you can have is you can have independent entities decide. It will never be a decision from the federal government down. But you can see there will be maybe business organizations that say we're not going to let anybody in unless they're vaccinated. You can see some colleges are already talking about that. I'm sure you're going to see some airlines that are going to say the same thing. So at the local level, you're going to have individual entities almost certainly are going to require, not all of them, but some of them will require vaccinations.
I want to read something actually about you. The Washington Post wrote about a focus group on the vaccine messaging, and your name came up during the conversation. And one of the pollsters wrote about the findings and said this: the data have shown that unfortunately Dr. Fauci has been politicized, and we need different messengers because even the right messages coming from the wrong messengers aren't always helpful. I have to ask you, how does that make you feel? You have dedicated your whole professional life to working on infectious diseases, to working with the federal government for over 40 years, devoting yourself to science and protecting the American people. When you hear that quote, how do you feel?
I don't take those things personally. There is an aspect of that for certain people that are correct, because if you look at the people that are politicizing me, there's somebody that all the way over on one level. But there are a lot of other people who look upon me the way they should, as a non-political person that I am, as a public health person, and listen to what I have to say. So if you have the extreme people the very, very far off to one level feel that they have politicized me. I mean, of course, if you look at some of the congressional hearings that have gone on, I mean, it's been a show. You know, people get up there like Congressman Jordan and Senator Rand Paul. Of course they've politicized me, but, you know, it is what it is. You just got to go ahead and do what you have to do.
You heard the breaking news a moment ago that Facebook is upholding its ban on Donald Trump, and I am not asking you to be political, but you know firsthand, you saw firsthand the power he has in messaging, including spreading misinformation about the coronavirus. What is your reaction to this news?
None. I'm not going there.
You know what? That is entirely fair. That is entirely fair. Dr. Fauci, thank you for joining me this morning. I appreciate it.
Good to be with you. Thank you for having me.